Good morning. We're catching up again today with Dr Mandeep Johal, and hopefully she'll be holistic dentistry and how it works in the collaborative space and why we need a team. I'll see where she's at this morning. There she is. Good morning. Look at us.
Morning, good evening.
That's
From
right.
Toronto.
Good evening. Absolutely. Good to see you again.
Good to see you too.
I'm just going to see if I can turn that volume up a little bit. There we go. Right, so we're picking the conversation up from last week. So I'll just reintroduce us and what we're talking about. I'm Mary Bourke and I'm the CEO of Myo Munchee, but I'm also a chiropractor. I've over 30 years experience and I've always worked collaboratively in my practice life and with my patients. And I'm here today with Dr Mandeep Johal, and she's a dentist with a focus on airway and overall health and function. And she's working with patients across the lifespan, and she's really going the big picture on how this oral piece fits into how we function as humans. So last week we were talking about, well, the big focus at Myo Munchee at the moment is chew, swallow, breathe as a functional synchrony and movement, and we were sort of pulling that apart and sort of looking at different ways that presents when there's dysfunction in your practice. So what I want to do today with Mandeep is talk a little bit more about how we work collaboratively, because I think people understand it's important, but how do you find the team and how do you work with the team? What does this even look like? How do you find the right dentist to work with, the right chiropractor to work with? And you're doing that. So I'd love to hear more about, from your perspective, how you started to do that. So
Thank you for that intro. Yeah, so my journey started because of my son. So my son now is 12, but when he was 4, he had crowded teeth. And then that whole, I think we talked about it last time, that whole cascade effect of his crowded teeth. And then it actually was his sleep. That was a major issue. My son actually has sleep apnea, Mary. I don't know if I ever shared that with you, but I was Dr. Bill Hanks, who's like, Mandeep, he has sleep apnea. I'm like, he might have sleep apnea. I'm like, what do you mean? I just contacted you for crowded teeth. And for those of you that don't know who Bill Hanks is, he was an orthodontist. He used to practice. He's still with us, thank God. But he's the one that told me, he's like, it's his sleep. And I'm like, are you sure? So then that led me to working with the ENT. And then he's like, you need to look at his tongue. And then I worked with a myofunctional therapist, and he introduced me to Dr. Shrusagi for a possible tongue tie. And then learning with my son, trying to help him. And all I had was, I was just like, he has crowded teeth. Remember, I'm a dentist, so I'm trained. You should have straight, perfectly white, pearly teeth, right? And I was like, wow, this is a lot. And then once we did a deeper dive, we're like, oh my God, he has a gag. Oh, he doesn't like to chew his food. All these things started falling together. So I know we don't have time to talk about that right now today, because I want to share more with you about the team approach. Is because of his journey. And I'm not saying I met with all these people at one time. I don't want to overwhelm people either. It took me time to learn, like, yes, it takes a team approach. So I work with currently 2 physical therapists, osteopaths, chiros. But I think the key is the more we learn from each other, Mary, I've learned when to refer and to whom to refer, because you can't do it all, right? It's like you can't do it all at one. It's too much for, we talked about the nervous system last time. It's too much for the family. Like, we got to look at the person, at like the child or whoever we're treating as a whole. And I feel like that's what we miss sometimes. So I don't want people to get overwhelmed. Oh my God, I got to see so many people. But just keep in mind that we got to put the pieces together. Take your time. Our body is magical at healing itself as well when we give it the right tools.
And I love that. And that's such a great conversation to have, because it's working out what's the piece that you start with that's going to give the biggest impact, and then building around that and working with the families, because that is so true, isn't it? It absolutely feels overwhelming. And I too have 3 children, and that's why I originally went on the journey of understanding more about neurodevelopment and behavior and sleep, all the things. We're always learning from our own near dear ones. And but it is so true. As a parent, you know, and I know what it's like trying to do all those appointments and get all that happening. So that's something that's really important for other practitioners to understand, is they probably do need all the things, but that you want to be careful of overwhelming a family, because we need to make it achievable. What's going to have the most ease with the biggest impact is how we need to kind of start and put those pieces together. And it doesn't all need to happen straight away. It's trying to map that journey out. And I thought it might be a good chance for us to throw around a case, for example, where we can kind of talk about how we would fit together and where we would start. And you and I discussed a case just the other day on a webinar, and he's an interesting, useful one to talk about, because he was a 6-year-old that came in to see me he came in actually primarily to get a Myo Munchee. Someone had told him about Myo Munchee, so he came in to see me at my chiropractic practice to get a Myo Munchee. But when I looked at him, I realised that a Myo Munchee was not going to be the place he could start, because he was totally blocked, could not nasal breathe at all. He had a lot of very, very tight musculature and postural adaptation around his mouth breathing pattern. And he had a lot of these retained reflexes, gag responses, different things. I was like, he's not going to be able to manage a munchie at all. So let's not start there. The other big thing that he had going on was he had a crossbite. He had his teeth in crossbite in relationship to each other. And he had very tight tongue, tethered oral tissues. So where do we start? So I started with him with chiropractic care to unlock the system, because his diaphragm couldn't work. He was stuck in a mouth breathing pattern, and I wanted to get some input into the system that would allow him to start functioning a bit better. But I knew we had to address this oral function, because that crossbite was sitting there. So every time he chewed and swallowed with his dysfunctional tongue posture and his crossbite, we weren't going to get anywhere long term for him. So I knew that I wanted to unlock the system. Then I wanted to get some dental work done there to allow a shift in the way that stability and function was occurring in the jaws, and then go back and do some more work with getting the neurology and things set up longer term. So it was kind of that idea of piecing things together along the way. And that's often the way I would work with it. I would do a period of activation of the system to get things working, refer them out to another piece of work, whatever that was required, or it might be Myo Munchee, myofunctional therapy for a period of time as the priority. Then we're checking in along the way to make sure the postural adaptation's coming in along the way. Then we might be working with podiatrist feet. We might be looking at the feet as the input. How do we fit that in? So it's really looking at who's in front of you and which bit you do first. And that was one that I found was really needed. You need to keep touching back to the body posture and function, but it's really working out with the dentist. Yours is a longer term approach as well. So do you want to talk me through what it looks like for you sometimes in your practice?
Yeah. So I love that, like you talked about, this is what I want everybody to kind of realize what you did. They came to you for a Myo Munchee and you did not give the Myo Munchee. So that's okay to do. And I feel like a lot of us will take a Myo Munchee course and be like, oh my gosh, I'm so pumped. I can't wait, because it is amazing. I love it. But there's a place for it and a timeline, right? And if this is the child, if you gave them the Myo Munchee or you gave them or you did even if you did airway orthodontics and expanded them right away, this was the kid that was going to be a pain in your butt as a dentist. That's like not compliant, doesn't like it in my mouth, take it out. The mom's like, I can't, this is so stressful for me. Because that doesn't happen often, but when it does, you have to sit back and be like, oh, this kid's actually not ready. Yes, they need expansion. Yes, this kid had a crossbite, but this kid is not ready because he has maybe some sensory stuff going on. So in my realm, sometimes it's easier for us to describe to other practitioners. It's like sensory stuff going on. Like I have some kids who are doing tongue exercises and they're like, I can't do this. I'm like, what are you trying to do? Like, I'm trying to do a cave and this is your cave. And I'm like, this kid is not ready for even a tongue tie release. He's not ready for expansion. This kid doesn't know, even though he has a tongue, doesn't know that his tongue is here and the roof of the mouth is there. And that sounds silly to a lot of practitioners when I share that. And I'm like, hey, why don't you take a Q-tip, have them close their eye, I do that because it's called mismapping. And I'll have them touch, and I'll close their eye, and I'll take a Q-tip and I'll touch the top right of the palate. The kid's like, I don't know, you touch the left. Okay, I'm like, let's touch now. I'm gonna have you close your eye and let's touch the left part of the tongue. The kid's like, I think you touched my right. How do you not know? This is the kid's mouth. The child has no idea what's left and right. So we need to just stop and be like, okay, we need help. Is it OT? What do we need? And I know like it's primitive reflex integration, working with the OT or physical therapist. So I know what to direct them, but I only know when to direct them, Mary, because I've learned from OTs and I've learned from physical therapists and practitioners like yourself, like what's primitive reflex, what's mismapping, what's going on with the cranial nerves. I did want to share another quick example, though, that it just happened today, which I love practicing too, because these are really cool cases that come up. I had a mom in my chair who's like, she was starting on a journey where her kid just, was clumsy and just silly all the time. And she goes, somebody recommended a physical OT. And she's like, what's the OT going to do? Primitive reflex integration. And then, but the mom just stopped and said, oh my God, this kid can't converge or diverge either. So his peripheral vision was off. So the first thing they did was they worked with a vision therapist, got prisms, and then they did the primitive reflex integration. Then they did OMT, myofunctional therapy. Then we did the release. So there are steps we have to take. You can't do myofunctional therapy. You can't have the kid do all these exercises if they can't see in their peripheral. So that's where I feel like that's where I created like the heal idea came to me. It was we need to educate each other so it becomes easier, because anytime a host these events, everybody's like, I don't know who to refer to. What do we do first? I'm like, it's okay. Let's learn more from what we do so we know when to refer and to whom.
That's fantastic, Mandeep, because it's one thing to recognize the dysfunction, it's then knowing who to refer to about it, because that's what's so challenging, because not any of us ultimately were taught any of this airway function, primitive reflex integration. None of us were taught any of it really at uni, how it all relates together. It's not, so I'm a chiropractor, you're a dentist, there can be an OT, a physio, there can be all sorts of practitioners, but actually it's all the learning you do outside of your university degree that starts to really put the pieces together. And there's nothing more fun and exciting than to go to someone else's lectures, because that's where I've learned all of this in the last 10 years, particularly has been hanging out in the dental space, in the orofacial, myofunctional therapy, speech pathologists. We all have different superpowers. And I think for parents, it's really finding a practitioner you resonate with, and the parents who are picking this information up, it's so intuitive for them. They really know. And I love what you were talking about with the eyes and the oral function. We're all connected. The whole body is a functional unit. You can't just take pieces out and expect them to operate in isolation. And that whole idea of the mapping of the palate, the child had no idea. A third of all of our brain information goes into the lower third of the face. And to articulate well and to feed and speak, all the things we do with that tongue and oral space, you need really good mapping. And it should be mapped in that first couple of years of life to be able to then go on and utilize the functionality well. So they're complex things here. So I've just got someone there. Do you take questions? Well, put it in the chat and we'll see if we can do a few questions, because we're tapping into some interesting ideas here. And I think for the practitioners who are part of what we call the Munchee movement, the Munchee is a tool that is used by all the different practitioner types. And that's what's been great for us, because anyone who's listed with us as a certified Myo Munchee practitioner is by default exposed to all the different educational pieces, because it's part of our education. So we put little bits and pieces in there of all the overviews. So it gives people a start. And then with, as you're talking there with Heal, what Mandeep's doing is she's running events for the practitioners to get exposure to all the different professional types, which is wonderful, going to different areas and putting on a conference. And that's such a great opportunity, because not everyone does get the opportunity to go to other people's events or know which ones to go to. So perfect that you're doing that.
Thank you. Well, because I get invited to speak at a chiro or osteo, then I get to learn from them. But when would it had ever occurred to me to attend an osteo or chiro conference? So that's where the idea was like, let's put you guys all under one roof and learn. So
Yeah.
did we have time? What about older children?
Yeah.
We're done so much with examples, treatment appropriate. Who do you go to? Where do you start? That's what we're talking
Yeah.
about.
Yeah.
It's hard, and it takes a village approach. And I would say also to parents, go with your intuition as well. Like, don't always be on online, this is what I'm reading, because we're seeing a lot of things, because there is a lot to learn. Go with your intuition, go with your gut too. What is good for you and your child? I
Yeah.
think we forget that primitive feeling that we have because we get scared. So don't do anything out of fear. You're still gonna grow. You're still gonna grow.
Yeah, yeah, and have a look at, we do have a listing page, certified Myo Munchee practitioners in your area. So if there's someone there, you can go there and use them as a point of, where do you think I should start? Because they should have a reference community. That's what we've been really trying to establish, is that. And I know that Mandeep's also developing listings and communities. That's what we're really trying to do. So the idea would be, it doesn't really matter where you start, you can't get it wrong, as long as the people are able to recognise what the primary is. And that's, so I would say, either if you're going to look at dentistry, you need to look at someone who's got a good understanding around airway and function and how that all relates to the body posture as well. Because with the older kids, they've set up a lot of adaptation around it. So there's always a postural component. If you're looking primarily at their teeth, then you're probably, if that's what's telling you there's an issue, depends what's telling you there's an issue. What's the thing you're looking at with your child that's saying, I think this is of relevance for me? And it can be, and you'll often find that there's a lot of these symptoms. There might be the teeth, there might be sleep, there might be behaviour, different things that you're sort of going, a few of these things are making sense, are not
Mhm.
fitting well together. And what you want is someone who'll take note of all of them. Someone who looks at all those dots and goes, okay, who else do we need to work with?
Yeah, like for instance, if a child, you mentioned your example too, the child could not breathe through their nose. How are you going to give them a Myo Munchee if they can't breathe through the nose? So we need to make a referral to an ENT. They're the experts. They're the ear, nose, throat doctors. Take a look. Is there obstruction the causing that? And if there is large tonsils and adenoids and they need to be removed, I'm not pro surgery, but sometimes they have to be removed to get them out of the way, and then start investigating what caused the large tonsils and adenoids as well, because they have systemic inflammation. So it all depends, like you said, what is your primary concern and what are you trying to achieve?
Yeah. And do trust that intuition, because you know your child. And what will often happen, especially with younger children, is they might get told, oh, they'll grow out of it. Trust your instincts. Your child, we're all born with the genetic potential to be thriving. And we want to see thriving children. We want to see children who are well, who are sleeping, who are bright and engaged. And we want to really look at that. If you're starting to see things early on that their mouth breathing, I can hear them snoring. They're a couple of the most classic things I think that parents are seeing, or the crowded teeth. And you're a parent who knows they already themselves had a whole lot of issues with jaw growth. Get in early, because there's so much we can do when the signs are there before the symptoms become a big issue. Much harder to treat a symptom picture than to look at some signs of dysfunction and go, okay, let's look at this before it gets full blown into something that we have to then manage.
I
Someone says
agree.
allergist too is one of the comments that's coming up. Yes, all part of it, definitely part of that, especially in this orofacial functional side of things. You've got to look at what's creating the blockage to the breathing. What's the underlying source of dysfunction around the breathing? And just to flag there that sometimes there's a big neurological piece to that too. Like that little boy that I saw, it was that it should get wired into the system when they're born, when they arrive. They've been sucking in utero, they've been practicing the suck and the swallow with the amniotic fluid. Then they arrive in the world and they've got to get the breathing involved, and they start to feed. So the suck, swallow, breathe coordination is wiring in that all of that breathing function for the air, and there's a whole lot of neurology involved up here too. And if that's never been activated properly, and babies and humans are incredibly adaptive, they'll survive. They'll work out a way to survive. But a mouth breathing response is a survival response. It's the system working out another way because the nose wasn't working. So it's looking at all of that and understanding what's ideal. How do we optimize? Because you want all these functions automated so the brain can get on with the complexities in life, not how to chew, swallow, breathe, because we have to do that a lot.
It's true. I mean, the body, like you said, it's very good at compensating. And I had another example today of a baby where the parents came in for the baby's tongue tie, and the dad's like, "Oh, I'm tongue tied, but I'm fine." And I'm like, "You are, but like, let's go over symptoms." And the wife's like, she goes, "You lisp sometimes." He goes, "I do." He goes, "I can't believe I have a lisp." I'm like, think about how hard your brain is working to compensate for that lisp, for that swallowing. I go, "I bet you you inhale your food." He's like, "How do you know?" I'm like, "Because you're so tied that the roof of the mouth has never had a sensation that if it did, you would gag." And he's like, "You're right." He goes, "I can't chew my food. I would gag on my food." So I'm like, "Listen, I'm not trying to give you a complex, but for somebody like an adult like him," he goes, "Where do I start?" I'm like, "Let's work with some myofunctional therapists. Let's just," because he had no pain, like he didn't have neck pain, headaches, migraines. He was just like, his speech gets slurred. And I'm like, "Yeah, you're young now. You're like early 30s. But imagine that brain energy that goes to try to make those perfect sounds. Imagine when you're 60, is that capacity of the brain. You're still going to have it, but that energy that's being put into making those sounds." I go, "Your body's going to be 60. You got to, energy has to go somewhere else." I go, "You should start now instead of later." So it's just, our body is so good at compensating, is what I was trying to jump on here, Mary. Is like, it is. We can do it, but at what extent do you want to do it?
But at what expense? And I think that's a fantastic point. And this is, yeah, that's a great case, because it is often the comment, isn't it? "I was fine. I've gone through all of this and I was fine." Parents will often say that about things, and you think, well, and actually the world was kind of a different place 30 years ago as well. There's a lot more are trying to manage through. We had better inputs. We had better inputs that were helping our neurology function better. And now I think that's such a great way to look at it, with all that effort required for that swallow, with that chewing function, with the inhibited tongue. And I'm just thinking about the forward head posture and the full body swallow that occurs when there's a dysfunctional swallow pattern. That's years of chronic neck, shoulder tightness, stiffness. It's kind of these simple things that, if we can do an intervention at some point, just making sure we know what the root cause is. And I think that's what we're about, you and I, definitely in our practice. We're looking at people going, where did this go off track? Where was the point at which this system became dysfunctional? So we can make sure we get an input there to shift the trajectory. And that's why it's so much easier with children, because there's less layers to unpick.
Exactly. I always call it the onion layer. The more compensations you have, the more onion layers we have to peel. So I told that dad, I go, "As soon as you turn 45, like your neck is gonna, like you're gonna have stiffness and headaches because those muscles are gonna be like, I work so hard and I'm done."
Yeah.
Right. So I give this example to people all the time, parents, children. I had my release done 8 years ago. And the first thing I did is I called my mom. I was like, "Why did you not do this when I was a child?" She goes, "What was wrong with you?" She goes, "You talked a lot, you ate a lot, you had no issues, you were happy, you slept." Okay, Mary, when I look at my pictures, I was a mouth breather. I was a thumb sucker. And I look back and I'm like, oh my God, I was able to sleep wherever I wanted. I definitely had sleep disordered breathing. So I go to my mom, I go, "Mom, you deprived me. I could have been an astronaut. Could you imagine?" She's like, "What's wrong with you? You're a dentist. You're great." And I'm like, "No, you deprived that of me." Because I was able to sleep and I wanted to take naps when I was an undergrad. I was like, "Oh, guys." And we would be out and I would be taking a nap and feel refreshed, but nobody else did. I just thought it was me and I thought it was a gift. So it's like until you get better, you don't realize like, oh my God, that actually was not normal. And I did my release because I had really bad neck pain because I was in dentistry. Dentistry just made it worse. If I wasn't in dentistry, I would have probably released it now in my 40s and not 8 years ago. But yeah, it's like what could have been. So it's that potential, you know?
Yeah,
Yeah, I
yeah,
could have been an astronaut.
absolutely.
You never know. True
it's
story.
it's probably a good note to finish on, Mandeep in the astronaut suit. Still changing the world. It's been great to have you on for 2 sessions, and I have no doubt that people, you've got people thinking, and I love that about the way you talk and describe things and put things together. It's fantastic. So I hope we can get together again soon, and we'll definitely do what we can to share about when these heal events are on and where they're on, because it's a great opportunity for communities, practitioners in communities, to really meet each other and yeah, get connected and learn from each other. Wonderful.
Oh,
Well,
I
thank you,
appreciate that
Dr.
so much.
Mandeep.
Thank you, Mary. And I love what you're doing. Please, thank you so much for connecting to the dental community and educating all of us. Thank you so much.
See you
Bye.
soon. Bye.